Okay. I'm just recording what you're saying right
No
now
problem.
and your feet.
No problem. So, you always want to take this off.
Can I record your hands?
Sure. Because you don't want to put the needle through the hard plastic.
Okay.
That would be kind of silly. So, you just pop it off. Okay. And then you see the plastic.
Mm-hmm.
That's where the needle's going to go. Now you're going to have this 3cc syringe with a 75 or a 25 gauge needle.
Mm-hmm.
So you're just going to open this up. It just peels open. Okay.
And they gave me second needles for drawing, and then
And so
okay.
that's what this is. This is an 18 gauge needle. Okay. So you're going to twist this one off. Okay, it just twists off.
Okay.
And you're going to set it aside. And then you're going to get the 18 gauge needle out. And you're going to twist that one back on. Okay.
Okay.
You're then going to take your alcohol pad and you want to clean the top of the bottle.
Okay.
This is to just help try to prevent infection. You can keep that pad because you're going to use it on your thigh later.
Okay.
I always dry the top off with a cotton ball so you don't get alcohol in your injection. Now you're going to start with 0.25, okay? So you want to pull back on the plunger. So each line is 1, right?
Okay.
So you're going to pull back to 0.25, which is actually right there. Okay, so
Okay.
you've got the air in the needle.
Okay.
You're going to go straight up and down into the rubber stopper, and you're going to push the air into the vial.
Okay.
It just helps pressurize the tube a little bit.
Okay.
Now this is where people get confused. You turn it upside down, and you just need to make sure that the needle's in the fluid level,
Not in the air.
not in the air. Because as you're pulling more out, there's going to be less and less fluid, and sometimes people will have the needle out of the fluid, and that's not helpful. So we're going to pull in. You can pull in as much as you want, right? And then you just push back up to 0.25, which is there. Okay. And you just take that off.
Okay.
Now, you see how thick this needle is.
Yes.
This is not something you want going into your body.
Okay.
Okay, so you recap the needle and you twist it off.
Okay.
And you put the small needle back on. Okay? Because you don't want to be putting that big thing in you.
Pink goes in that guy, blue goes in me.
It depends what color they give you at the
Okay.
pharmacy, but in this case,
varies,
yes. Yeah. So then you just pull this top off.
Okay.
And this was the air level that you were talking about. You just push until you see a little bead,
Okay.
and then you're good. All the air's out. You don't need to worry about it.
Okay.
Okay, and then we're going to have you learn how to give it to yourself in your thigh.
Okay.
So sitting here, if you
Okay.
can put your pants down for us.
Please hold.
This is where we put the technical difficulties slide.
Oh my god.
What kind of belt did you put on today?
It's not a belt.
Oh.
Something else.
That's right, kids don't wear belts these days.
Okay. That's okay. No worries. No need to be embarrassed. So, with your leg, let's go in this one today.
Okay.
What you just need to visualize is that you have a femur running through there, and you don't want to inject into the bone.
Okay.
Rarely does that happen, but you want to go kind of in the outer quadrant of the leg.
Okay.
So you'll take your alcohol swab, and you'll clean that area. Good. And you want to go kind of little. There you go. Perfect. And then you'll dry it off. The reason you dry it off is because the alcohol, when you stick the needle in, it'll sting.
Okay.
So you dry it off. And then you're going to take the needle. Now, when you inject it, you don't want to go into the side or into the side. You want to go straight up and down like a dart.
Okay.
You only have nerves on the first layer of skin. So once you're through the skin, it's not going to hurt anymore. So if you stick it through and you have to let go of it even, it's fine. It'll just stay there. And it's okay if you need to reposition. Because this testosterone is actually really thick. So it
Okay.
actually takes some muscle to squeeze it.
Okay.
Now, one last thing before you do it, okay? When you're squeezing it, what I want you to concentrate on is putting all the pull from your fingers and the pressure on the plunger in this area so that you're not pushing it into your body, right? You want all the pressure to be up here with your hand.
Okay.
Okay. So then whenever you're ready to do it, just straight up and down like a dart. You just have to take the cap off.
Trust me, it's not going to hurt as much
Oh.
as you expect it
That's
to.
okay. You just twisted. All you want to do is pull. There you go. Good. And then you want to leave the muscle nice and relaxed and don't tense it up, okay? The first one's the hardest.
I can do this. I can do this. I can do this. I can do this. I can do this.
It's straight up and down.
Come on, I'm a total wimp and I do it once a week.
You want to do the first one?
No, you gotta
No,
do it
you
so
have
you
to.
can do it.
Yeah.
Okay.
Sorry, I can't help you cheat on this homework.
Do I do it like from up here? Or...
Nope, just down low and just go in. There you go, good. And then you
Okay.
can squeeze it in. And you'll feel it's thick. You gotta really push hard. You're getting it, good. There you go. Then you're gonna.
Did I get it all?
You got it all. You're
Okay.
gonna pull it out and you're gonna put that right where it was. Good. Perfect. And then I'll hold on to this for you now.
Okay.
So then what you would do is just set this aside. You did it. And then you'll have a Sharps container that you just throw all that into, okay?
Okay. Okay. Do I Band-Aid?
If you're bleeding, otherwise you don't need to. Now, you may experience a little bit of pain in the injection site area,
Yeah.
and what that's about is that your muscles are all they're all caught in these little sheaths of fascia, and so when you put extra fluid in it, it causes it to expand and it puts pressure on the muscle, which can leave it feeling achy. In a couple days, that should resolve. The other thing you always want to watch for is an injection site infection.
Mm-hmm.
So if that area gets red and inflamed, I want to know about it.
Okay.
Hot to the touch, that kind of thing. But you cleaned it, so it shouldn't happen.
Okay.
There you go. You did it.
High five!
Oh god, that was dangerous. Face 5.
So there you go. All done.